Good morning. I'm Dr. Neal Seltzer. I'm a dentist practicing on Long Island, New York. This is Gina Pepitone. She's a registered dental hygienist who works in our practice. First of all, I wanted to thank everyone for being here this morning, and I wanted to thank the American Sleep and Breathing Academy for having us. This is really exciting for us. Our practice is a combination of a dental practice and a dental sleep medicine practice delivering oral appliances. Our practice has been on Long Island since 1984, and we started practicing oral appliance therapy and delivering that treatment back in 1991. And we're going to tell you about the transition of how we built that practice, where we are today, how one practice feeds off the other, how they interact. Something that Kent brought up on that little incredible survey, which was great information for me, is the fact that a lot of the people in this room are kind of at the beginning of their quest to do this. I wanted to get a little feedback from you. How many of you really are still practicing dentistry at a decent level? Okay, so that's great. So this is going to be perfect for you. We're going to talk about how we built our practice, how we market our practice, how to build the dream team in everything from reception to billing to marketing, and how we accomplish that. So we're going to go back in time to 1991 when I was snoring. All right, and I'm going to assume that a lot of the people in this room probably got into this to some degree because somebody they know, perhaps themselves, were snoring and they wanted to find out more about that. So our practice had been developing at a nice rate in dentistry over that 7 or 8 years that we were in practice. And I have a partner who's out there in the audience also. That's Dr. Jeffrey Ryan. Jeff, why don't you put your hand up there? And he and I are really into keeping at the cutting edge in everything that we do. And so dentistry was really moving in every direction that we could. Any type of technology, we would purchase it. So we were always open-minded, we were always out-of-the-box thinkers. I was snoring, and my wife was driving me crazy. She was pushing me to do some type of surgery to remove and get rid of the problem so that I wouldn't have to sleep on the couch. At that point, I was getting a little nervous, and I said, I have to find an alternative treatment to this. And lo and behold, this is back in 1991, I found a small advertisement in one of the dental journals about the size of a postage stamp that said SnoreGuard. And I was like, wait, what is this thing? And there was an 800 number, and I called up the number, and I spoke to a gentleman by the name of Tom Mead. I don't know if any of you know him. He's actually from this area, and he's a dentist who was really an early icon in this industry. He had developed a monoblock little boil and bite anti-snoring device. So I ordered one. It came to the house in a box. It was a boil and bite device. I did what the instructions told me. I went to bed that night, and I was really, really so quiet. My wife probably thought something had happened to me, and I was on my way not having snoring anymore. So that's kind of how I left it at that point. About 6 months later, I was in the middle of treating a patient, dental patient, and I got a phone call from a sleep doctor in the area. I never even knew who he was. I didn't even know what sleep medicine was at that point. I got on the phone with him, and he said, look, I have a mutual patient here with you. His name is Richard. And he said, Richard has sleep apnea. He says, and you need to treat him. So I said, okay, let me get back to you on this thing. And then Richard called me. And Richard said, and I got to give you a little background on Richard. He was the kind of a dental patient that you couldn't get him to do anything preventive. He was very cheap. He wouldn't spend money on anything. If the insurance didn't cover it, that was the end of the deal. So I get on the phone with Richard, and he says, look, you have to save my life. He says, they told me that if I don't treat this apnea thing, and they put a mask on me and I couldn't sleep with it, if I don't do something, I'm going to die. And I'm really, I'm freaking out. So I was like, okay, Richard, and meanwhile he's bombarding me with all this information. And I said, let me call your sleep doctor back again. And I said to the sleep doctor, how did you find out that I do this? And he said, well, I got something in my fax machine. It says that you're the local expert in oral appliance therapy. I said, where did you get that fax from? How did this develop? He said, there's a company on there, SnoreGuard, that I got the fax from. So I immediately started to laugh. I called up Tom Mead, and Tom said to me, he started laughing. He said, oh my God, he says, I'm a businessman. He says, whatever dentist ordered a SnoreGuard, I would fax to their area information about you're the local genius in this. And I was like, this is incredible. So he was a smart businessman, Tom, and a real early icon in this industry. So I then called Richard back, and I said, Richard, I said, okay, I said, I can make you one of these things. He said, well, I got to get in there yesterday, and I don't care what it cost. So I said, he doesn't care what it costs. This is someone who I couldn't sell, 20 cents worth of dentistry to. So I figured, okay, at that point, the appliance, I think, cost about $75. I said, you know what, Richard? I was really going to be bold here. I said, $600. He said, I'll be in like in a half hour. I said, no, you can't, I got to order one. And so we got him in, we did it, and lo and behold, his appliance did the trick. It stopped his snoring, and he couldn't stop thanking me. And again, I didn't know anything about dental sleep medicine at that point. And so there was really no follow-up to this thing. So at some point in the middle of all that, I came into Jeff, to Dr. Ryan, and I said, Jeff, this thing is incredible. He didn't really even know I was dabbling in it with Richard. And I said, the practice has to go in a new direction. And that was kind of the beginning of us entering and exploring into the world of really, at that point, just snoring. And we had heard about apnea a little bit, but we didn't know a lot about it. I'm going to let Gina talk for a minute about how she kind of came into this sleep world, and then we're going to put it all together, and we're going to talk about building this dream team and how you perhaps take your dental staff, train them to be a sleep team, and I will just keep building on it. I hope you have a lot of questions. I like to talk, so this is a pretty long presentation. We have, I think they gave us about an hour and 45 minutes, but we ran a little behind. We'll try and keep up with as much as we can, and if you have questions after, feel free to grab me. I'm here all day. And this is Gina.
So my story also has a little bit of personal meaning to me. I was a dental hygienist. I started practicing in 1989. I loved dental hygiene. It was my dream job. I was able to help my patients, great, talking to patients, learning about their lives, connections, as well as getting married, having children, and being able to work part-time. And, it was a really good career for me. My husband is a New York City firefighter, and he was involved in 9/11. And it was a pretty kind of tumultuous time for us. Excuse me, I get a little choked up about it when I talk about it. But so he responded to the World Trade Center, and he was buried under there for a number of hours. After being saved, thankfully, and coming home, he had a lot of issues. And one of them was he started to sleep horribly. He had a little bit of post-traumatic stress disorder, and he couldn't breathe very well, and he was then eventually diagnosed with sleep apnea. So what happened was, they gave him a CPAP machine. And as soon as he brought it home, the minute that mask went on his face, immediately he would rip it off, and it would bring him right back to being buried. And he would try, and he would say, I can't wear this, I can't, I don't want it, I don't want to have anything to do with it. So after a couple nights of trying that, he stopped, and for years he suffered, and I suffered as well. So every night, snoring, gasping, waking up, and I would smack him and kick him, and I would say, for God's sakes, I need to sleep, you can't do this to me. And he's like, well, what am I doing? What am I doing? He had no idea what was happening. So I started doing a little research, trying to figure out what could be done. We definitely weren't going for surgery. He's never had any kind of medical procedure in his life. He didn't want to have anything to do with it, and I didn't feel comfortable with it. So after a little research, I found a dentist who kind of dabbled in making oral devices, and I went to him, and we made an oral device for my husband. And lo and behold, the first night, not a peep. So he was diagnosed with severe sleep apnea. His AHI was 48. His oxygen went down to the 50s. And he wore that oral device. First night, I didn't hear any snoring. No gasping, no choking. And then after a while, he started to get in a better mood. He wasn't having these horrible dreams anymore. And eventually went to go get tested, and his AHI was 0.5. So that had me sold right away. And I said, I need to learn more about this. And then basically just on my own, I did a lot of researching, a lot of reading. I started joining meetings and LinkedIn and Facebook and learning as much as I possibly can. And through all this learning, I found Dr. Seltzer and Dr. Ryan, and I contacted them and stalked them a little bit. And I said, look, I need to be part of this. I need to be involved. I need to help people because this is an amazing story and not enough people know about it. And P.S.,
yeah,
now we're
she
together.
Is, and, it was a perfect timing also because our practice was really, at that point, expanding exponentially in terms of our sleep practice. And we needed some help. And you know, it's incredible. There are not even that many dentists around who were trained as well as Gina was. And we brought her in, we had some conversations, and so we kind of really have divided our practice into two practices. We have a dental practice, Long Island Smile, and our sleep practice, Long Island Dental Sleep Medicine. All right, and that's what we're going to talk about today too, about this whole branding and building your reputation in your area, communicating with the physicians. And we've never slowed down on the dental end either. We're constantly building that, and we're doing all kinds of cool things. We're a high-tech dental practice. We have cone beam, we have CEREC machine, we have lasers. We just got the new Soleil laser. The thing is unbelievable. Just go look into that. It's incredible. So this is where we are today. We are boarded, Dr. Ryan, Jeff, myself, we're boarded in 3 different academies. We've branded our practice. We're the first office in New York State to have reached the accreditation. That was a gigantic jump in organization and kind of showing the world that our office is really cutting edge in sleep, and it organizes your world. If any of you have not looked into that from the Academy of Dental Sleep Medicine, it's certainly worthwhile. We've also, along the way, we became one of the Pro Player Health Alliance offices through Dave Gergen and this organization, and that's been a thrill, and we'll talk about that too, and you can look into that as far as building yourself and branding yourself.
One of the things I wanted to just jump in and say is that if there's anybody here, any practice that you are starting with dental sleep medicine and you're looking towards the future and you're thinking about getting accredited, I would start now. Create your protocols, create your procedures, and really have your team follow specific rules so that by the time you're ready for that accreditation, you already have all your paperwork and all your information laid out for you. You don't have to kind of dig back and find what they're looking for. That was my drum roll attempt.
All right. So building your sleep team. And we're going to allude, I'm a sports fanatic, so we're going to allude a lot to sports and building that team and creating that camaraderie of the team. And we do that in a big way in our office. We have nicknames for our employees. It's you know, that's the New York Yankees up there, you know, at least back in the Murderers Row type of era. And I want to just say a couple things. You know, dentistry, which I love, and dental sleep medicine I also love, you know, together they're a powerhouse, and they really, you know, dentistry's finally coming into a position now where, you know, we're holding our own with the medical world. You know, for a long time, dentistry didn't quite have that. But, you know, we all know as dentists, periodontal disease connected to the heart thing, right? You know, the periocardial connection. The oral environment is really a major player in a lot of what the human body is all about. Digestion, it's an indicator for things, and it's related to so many systems. And one of the cool things about dental sleep medicine is that you're now really linking yourself to so many aspects of medicine, you know, cardiology, pulmonology, ENT, psychiatry, psychology, dietary issues. You become a real big player, and that's part of what our practice has done, and we'll talk about it again a little more in the future of the presentation, but how to even tie all those things together with the medical world. Like Kent was talking about marketing yourself with the physicians, nothing is better than getting back and forth jargon and you know, having a real relationship with the medical teams. That gets you entrenched in there. That gets you part of what they do and how they think. And so part of your team is not going to only be your internal team, but your external team. Who are you going to refer to? What conversations? I mean, when you get into sleep medicine at a higher level, they're complex. It's not just putting an appliance in their mouth and sending them on their way. Some of these patients need a multitude of medical modalities to treat them. So the dream sleep team lineup. Gina and I will both kind of go over this together, but you know, it all starts, I guess, at the top with the dentist. You have to be the kind of person that wants to inspire this team. You want to be a leader. You want to have passion in everything that you do. And that's what we do. We're very passionate about it. And you have to have an entire clinical staff, someone like Gina. Now, we have dental hygienists, and we have, Gina's really our first sleep hygienist. And I don't know if we mentioned this yet, but Gina is, not only she's highly trained, but she lectures around the country, training hygienists how to become an essential part of a dental sleep medicine team. She has an online course through the Academy of Clinical Sleep Disorder Disciplines. And if you have hygienists, I urge that you let them go over there and start looking into that, and they can become an accredited hygienist. You want to elaborate on that a little bit? Or?
Not too much, really, but what I'd like to say is that most importantly, I think a lot of people here are dentists, and I don't think you can do it alone. And I've been a hygienist for close to 30 years now, and going to courses over the years, you know, you take these day courses, weekend courses, you take all that information back to your practice, and you say, okay, team, this is what I learned, and this is what you have to do. Well, it's near impossible to get that done. You really have to involve your team. And one of the greatest things that I've been fortunate enough to have is to work with people that allowed me to get that education and that knowledge. And our entire staff is educated in dental sleep medicine. So when you look at your staff and you look at your reception area or your hygienists and your assistants, you want to make sure that you have the right people that are there that have these things that you can't teach. Like, they have self-initiative, they have motivation, they have integrity, they want to be there to help. They see your vision, they share your vision. So sometimes you need to surround yourself with the right people so that you can get the outcome that you're looking for.
Exactly, and that, you know, we have camaraderie, we really do function as a team. Everyone knows what everyone else is doing, and part of the building and selecting of those team members are all those intangibles. You know, you need people that have that kind of self-motivation and compassion. We have, you know, when it comes to like our front reception, the people, when you pick up the phone, you know, those people are like, they're the kind of people that when you're listening to them, you get a warm feeling. It isn't like you're a number or a piece of meat. You're getting treated by a professional who is already welcoming you into our practice. It's a good feeling. You could see them smiling even though you don't really see them. So
one of the things, I don't mean to interrupt, is with receptionists, very rarely do you see receptionists or front desk at any kind of meetings or getting any kind of education involving dentistry or dental sleep medicine. And they're the first line that your patients come to see. So whether it's on the phone or in person, those people can make or break your practice sometimes. So you want to make sure that they really know what your therapy is, what you're treating, how you work your protocols, and be able to answer those questions on the phone or in person. And don't just say, well, when you see the dentist, he'll talk to you or she'll talk to you, you know.
And don't forget, as you go into dental sleep medicine, you're now a specialist. So I don't know if anybody here is a specialist. I know, Dan, you're an orthodontist, a prosthodontist. I mean, there are some orthodontists. It's a whole different mindset about how you're going to present yourself to the outside world. We get referrals from general dentists. We work interacting with them just like we're an endodontist or an oral surgeon. So, education, can't say enough about it. I've been learning since I got on the planet. I love to learn. I learn about everything I can, and I do it in a passionate way. Not just dentistry, but anything. And knowing as much as you can know and getting into that medical arena is key. The physicians are smart guys, and they want to know that they're dealing with somebody that knows what they're doing. You're going to have to be able to converse about sleep studies and different medical issues and other illnesses that you kind of learned in dental school but didn't worry about as much. So we joined all these organizations, and we got to that diplomatic level. We took more and more courses. We learned from the vendors. We learned from meetings. We learned for as much as we could to get to the top of our game. I want to just say one thing about this organization specifically, and it's not just because I'm here and doing this, but these guys are movers and shakers, and you should be glad that you're here. I'm not doing a commercial for them, but a lot of cool things are happening with this organization, and it's great to be part of it. They're dynamic. You're a person like Marty Russo the other morning, the congressman. I mean, we're getting to the world through people like this and through the passion of the people that are here, that are really getting a feeling and an understanding of the power of what we can do as dentists to change the world and giving people this ability to breathe. And the more you learn about breathing and sleep medicine, and it's interesting, this organization is called American Sleep and Breathing Academy. It doesn't even say it's dental or medical or anything, because it's all of that. And the power of breathing and sleeping is so recuperative for the body and so important for every system that we have as a complex organism. The more you do it, the more exciting it is.
I just want to talk a little bit about education as well. So one of the things that I enjoyed most about learning about dental sleep medicine is once we started to get a little knowledge about it and see a few patients, the team would get together and do some local educational presentations. So if you have local libraries or Kiwanis clubs or what else? Like even synagogues or churches, little group meetings.
Elder clubs.
Oh, right. A lot of those little places where the elderly meet, things like that. You can go and give a 10, 15-minute presentation, bring some snacks. They'll be happy to listen to you and get the word out there that, snoring is not just snoring, and sleepiness is not just sleepiness. Especially the elder population is not aware. A lot of them, don't have the care that they really need. So getting the word out there, it's a very easy way to go out and kind of spread the word about what you do and maybe start a little bit slowly that way as well.
It's going to be interesting as dentists if you're just beginning. Dentistry is a little bit of a hard sell. You have to be a good salesman. You're fighting discretionary income and all kinds of things. Sleep is a pretty cool thing. Everybody wants a good night's sleep, and nobody wants to be sleeping without their bed partner and the snoring. You really can do some cool things with this. So building your infrastructure. Let's start there, Gina.
Okay, so what we're going to talk about a little bit is screening tools, patient education, technology, software, and your systems, and how a little bit of everything can kind of build your practice slowly, not only your dentistry, but as well your dental sleep medicine practice.
And we're going to go through all these. So, screening tools. Why don't you talk a little about that, Gina?
Okay. So screening tools can be a lot of different things for different people. What we do in our practice is when they're coming in and we have health history forms, we're adding different forms to those health history forms, like an Epworth sleepiness scale or a stop bang, or simple questions about, do you snore, do you feel sleepy? Little things like that that are very easy for patients, just add a couple questions to check off on. We also have pulse oximeters, so something really great for your hygienist to do, so they should be taking blood pressure, but do they ever measure the patient's neck, and do they ever do a pulse ox? A $20 pulse ox from CVS on a patient's finger, all it does is have the patient ask a question, why are you doing this? And there's your conversation opener to talk about oxygen and what it means in the daytime and what it means in the nighttime. So little things that you can use to help screen your patients. There's tons of apps. iPhone has Snore Lab, Sleep Cycle, these free apps that your patients could get. They're always on their smartphones. Little things that they can follow their sleep patterns and maybe find out a little bit more about them. And you'd be surprised, patients are really interested to know how they're sleeping and what they're doing at night. So even as just a little game for them, they'll do it, and then you may discover something else while they're doing that.
And most of them have some issue or know somebody with an issue, so it's a pretty easy subject to get into. Patient education, we have a tremendous amount of information around the office for people to peruse and take home, and we have teaching tools to help explain things in their office. The airhead, the little airhead
So
model.
we have a little guessing game for you guys. We're going to play this. And if somebody could raise their hand and let me know who this possibly could be. Who said that? Here's your prize.
Yeah, so basically what this is, can you just hit it so it's not so clear, you know?
Oh,
go back
sorry.
one, go back one.
Going back.
So the airhead is just a demo model for explaining how the airway, the muscles relax and how the airway collapses at night. That's been one of our greatest little tools in the office for showing patients. They immediately understand, oh yeah, the uvula, that little punching bag in the back of my throat, and the tongue, and then they say, I thought you could swallow your tongue. No, you can't swallow your tongue. But you can collapse and relax, and you know, all the fat in your neck and all this is all closing you down at night. And what was that? Airhead, you can Google it. I mean, I don't know exactly. What's up?
DABD Technologies in Lawrenceville, Georgia.
Right.
Chuck
Okay.
Boyd.
Yeah,
I invented it. Jeff, my partner.
is that true? I didn't know that, Richard. Okay, well,
I didn't want to name it the client.
We need a new one.
listen,
We need a new
give
one.
Jeff some money and we'll keep talking about it. He's sitting in your eye. And, but anyway, all this information around the office, it stimulates conversation, it educates them, and it's great in letting them know that this is all about there. And it also just represents you well. It shows, you know, what you're doing. So.
Yeah, we have tons of brochures just sitting around the reception area. So when dental patients come in, they're reading a little bit about sleep apnea and, you know, maybe thinking that could be somebody that they live with or know themselves. We also have tons of demonstration models in the operatories. So even when a patient comes in and they're having a cleaning or a dental procedure, and they say, oh, you know, Dr. Seltzer, what is that? What do you have that up there for? I've never seen that before.
Also, you know what? When you go out and meet your physicians, talk to these companies out there, get demo models from them, bring that demo model to the physician, say, look, this is, you can show your patient, and all these companies are willing to do it. And if they're not, twist their arm
Yeah, and a
little
lot
bit.
of them will give you demo models for your physicians too, or make
That's
them.
what I just said, that's what I.
Oh, I thought you meant, okay. Sorry.
All right, so, okay, so technology. Like I said, in our office, we're like techno addicts, you know, everything we can get, we get. And you know what, if something doesn't pan out exactly the way you think, we don't even look at it as a loss. It's a marketing tool, it's a training tool, we learned something from it. John Nadeau spoke about the pharyngometer. You had Rick Bonato talking about the DentaTrack and the reader. We're one of the first offices in the Northeast to have used the CCAT Air with the CEREC and the cone beam, and completely building appliances digitally, no impressions. It's incredible. We use the cone beam all the time for all kinds of things in dentistry. The cone beam has been a remarkable tool building bridges to the medical world. We get so much information off of that. Not only does it make our dentistry better, But we built a tremendous amount of relationships with ENTs because we're finding all kinds of stuff in sinuses. And another great investment, the Matrix. We helped set up the Matrix system in 2 major hospitals in our area. The Matrix system, for those of you who don't know about it, kind of invented by John Remmers, another big icon in dental sleep medicine and sleep medicine. This is a titratable diagnostic. I don't want to call it diagnostic, it's really not diagnostic, but it will help give you an indicator. It's a predictor of how someone might do with an oral appliance. So how many people know about the Matrix? Okay, and how many people do not? Okay, so the Matrix, you can have a patient who, just like you're not sure if CPAP is going to be working. For someone, they do a CPAP titration. Where is this all going to be? Do they tolerate it? What's the position going to be? So you can use the Matrix system in a sleep lab to move a patient's mandible while they're sleeping and perhaps find a good place and see how they respond. It's not a direct diagnostic tool, according to John, but it will help predict with you and add information to your whole puzzle.
And then one of the things I'd like to add about technology is I use this with my patients as educational tools. So when I have a patient and we may be playing around with the pharyngometer, I'll show them how their airway changes as they move their jaw. You know, we always make sure that we tell the patient, you're awake, you're upright, or you're awake, you're lying down in the chair. But this is just to show you how the airway can be manipulated by moving the jaw forward and back. So it gives the patient a little bit of an idea of actually what's going on the inside when they are breathing a little bit too.
And you can also send all this information to physicians that you're doing all this, so they get a kind of a sense that you're taking some time and care and really look into the patient as a whole. Getting the right software in your office, very important. To do this at a high level, you really need a good software program. Some people create their own. 2 of the biggest players out there are Dental Writer and the DS3. I know DS3 is out here, and probably Dental Writer too.
Yeah, they're here.
And so this guides us. This is our system. This is, just like you have in your Dentrix or whatever for dentistry. This is the thing. This helps us follow through, letter writing, documenting all the information. So can't do it without that.
Following up with patients as well, keeping track of your patients, what level of therapy are they in, what phase are they, when they're due to come back. And also when doing your dental exams, this helps as well, taking the information that you need, all the documentation when you're filing through insurance companies, what's necessary for them. This kind of pulls it all together. So it really helps if you're going to do dental sleep medicine. It'll be kind of a big addition to that for you.
I don't think you can operate without it. Systems.
Which system do you guys use?
We're using Dental Writer right now. Okay, so systems. What do we mean by systems? So you notice in the middle, patient and physician. That's who we focus on. That's the 2 most important people you have to impress. Number 1, that patient. That's what you're there for. You got to get them better. Or at least you have to try and give it all you have to try and get them better. The other thing is, you got to impress those physicians. They're your source. And we're going to talk a little bit later also about what direction, what's your philosophy? Are you going to go strictly getting your patients from physicians? Are you going to market to the public? Are you going to be a combination of both? We'll talk more about that.
So really we want to talk about your receptionist or your front desk and how they're interacting with your patients, what their role is, and specifically what you want to accomplish when they're talking to the patient. Are they taking information in? Are they helping them with referrals? Are they talking to them about sleep apnea and oral device therapy? And then your hygienists are screeners, big time screeners. So we're going to go through a couple of little patient scenarios when your patients come in for their dental visits and what you can say based on what's going on in their lives. But your hygienists can be great screeners for you, and they're great to kind of tee up the patients and send them right over to you to start treating them for sleep apnea. So utilize them really well. Dentists.
Yeah, I mean, like I said earlier, They're the team leader. They're the person that has to know how to figure out what's going to happen, how to communicate with the rest of the team, how to be the liaison to the medical world, and select the appliances, and we're going to go into more depth on that. And then our auxiliaries. These, just like you have great dental assistants, you need to train and have great dental auxiliaries. What's going to happen is, as you evolve, you're going to go from maybe dabbling in this to doing a few a week or a month. You may do 1 or 2 a month, but before you know it, you're going to be doing several a day. And that's where we are. We're doing several a day, and you need help. You can't do this, you know, you can't, it would be just like doing dentistry without an assistant. And there are probably places that do that, but if you're high volume and you need to keep cranking, you need help.
And your assistant or your hygienist is somebody who's very close to you. They work with you every day. They are good points of contact as liaisons for your dental labs and when you're sending your packs out, your sleep cases to be fabricated. So building a relationship with your sleep lab is really great. I know you don't have a lot of time to spend doing that. You know, with all the dentistry, and also hygiene and assistants can help with that. Get to know your labs, get to know their managers, ask them what they expect, what they're looking for when you're taking impressions, you know, what you need to provide for them as well, so that they can give you some feedback and a better working relationship, quicker turnaround time, sometimes better products.
Yeah, just like your dental labs. I mean, you know, we've been working with certain dental labs for a few decades already. They know exactly what we want, how we want it. I know who's there, I know the technicians. You know, it's great. You can do that with the sleep labs also.
Billing?
Billing, very, very big part of this thing. You know, Kent went into some great stuff, and I'll share a story for you. I went to a pretty high-powered pulmonary practice on Long Island one day to do a little bit of a sales pitch. Brought a whole bag of models, books, paraphernalia, every article that's ever been written about us. I started undoing it. He said, "Don't bother." He says, "I know who you are. I know you know what you're doing." He says, "I have one question for you. Do you accept the insurance that my practice has?" You know, is whatever it was. "Do you accept medical insurance?" He says, "That's all I need to know." He says, "Because that's what's going to determine that I refer to you." That's a very frustrating thing to hit that. So this particular gentleman, that's all he was interested in. That's not to say that they're all that way, but this one, and that's why I bring up billing. You have to have you have to try to get in network with medical insurances, and you have to have a good medical billing team. This is all medicine, and you have to have those medical billers understanding what they're doing. We do it in-house. The people, you know, I said we've been doing this over 25 years, and our staff's been with us, some of them that long or longer, and they've grown up with us, so they have learned this, the school of hard knocks. But there are billing systems out there. Stacy Lehman with GoGo, you should all go meet her. She's great. I don't know if you're out there, Stacy, but there are a lot of billing companies out there. I don't know them all offhand because we do it all in-house, but they're going to be they can be a great asset for you, or you can learn it yourself. But this is a medical field, and you need to do things like a medical office. And that's really a very, very big part of this, because if you can't get paid, you can't do these. And patients in the medical world these days, they're used to everything kind of going through their medical insurance. They don't understand. Our dental practice is fee for service. It's a whole different ballgame.
So what happens?
Go ahead, Gina. Okay, I didn't know where you were. So,
I'm asking you, what happens if you don't have your systems, Dr.
This is
Seltzer?
if you don't have your systems in order. Confusion, all right? If you're totally out of sync, nobody knows what the other is doing, and that's how you would present. On the other hand...
That's Kathy. She doesn't look very happy when the systems aren't in order.
But when things are in play and you're a well-oiled machine, you're in sync, all right? So that's the team right there. And those are a group of assistants and hygienists and front desk and billing and Jeff and I in the back. So let's go to the next slide. Okay.
All right, so now it's game day. You're going to start your morning. This is a picture of what I see every morning. Oop, right in your face, Dr. Seltzer. What I see every morning when I look outside my back window. And and it's a great way to start the day. So the best way I can say to start the day in your practice is doing a morning huddle. How many people here have a morning huddle?
Yeah.
That's awesome. So I've worked in practices that had morning huddles and did not, and I can tell you the best way to work with your team and to treat your patients is knowing what to expect and talking about it before it occurs. So we'll sit every morning and we'll do about a 15-20 minute morning huddle, and most importantly, if the doctors are late to this huddle, they have to put money in a jar. So now they show up on time.
And,
Great.
It's, you know what,
If
it's
the
working.
staff is late, the staff doesn't get paid for the 15-minute time of huddle.
Yeah, we take it very seriously. It's really important. I mean, every business and industry does something like that. You know, restaurants, they have group meetings, hotels. You need to do this. This is the ultimate in terms of getting yourself organized for your day, and we can troubleshoot here. Where are we going to put an emergency? Do we have the right information? We have a patient traveling from, you know, another city to have something done. Do we have that report? Can you imagine someone showing up and going, "You don't have my stuff"? I mean, it would be embarrassing. So that you can't say enough about that morning huddle.
With your patients too, that if you're, they're not a sleep patient, but they're a dental patient, and in the morning you're going over with your hygienists and your assistants, and there are patients coming in that are taking certain medications, you can kind of key in on those patients, have certain disorders, certain health conditions, you can talk to them about too. So you want to get your team ready so when that patient enters the operatory, they can discuss certain things with them. And you can say, you know, so-and-so has hypertension, let's bring up, is it under control? Are you still taking the medication? Has it changed? Check their blood pressure. That's a very easy way to start a conversation during an appointment.
A lot of these patients are coming from large medical facilities, hospitals, gigantic practices. They're not functioning as well as we are with our team. So a lot of them are in disarray. And someone will say, "I've called Dr. So-and-so's office 10 times already." I mean, it's amazing what we're dealing with, but if it wasn't for that huddle, we wouldn't have known that something was missing.
Another quick note on the huddle is if it is a sleep patient and they're coming back with their efficacy study, you want to have that reviewed, the doctor and the hygienist and the assistant reviewed, and know what the results of that test is before the patient comes in, and make sure that you look back and you know what their initial concerns were, their chief complaints, and how things are resolved, and make sure that you're prepared to talk to the patient about that ahead of time.
Okay, so
we're going to talk a little bit about different patient scenarios and how you can open those conversations. And this is more for your dental team when they're screening their patients, especially for your hygienists and your assistants that can do this while they're waiting for you to come into the room. You want to do this one?
Okay, so you have a patient, Joe. All right, now remember, these are all dental patients right now. These are your patients. We're going to talk later about getting patients who are already, coming from the sleep world, but these are your patients. And this is not that atypical to have all of these medications going on. And they're all conversation starters. They're all openers for you to say, I mean, every medication somehow, to me, there's so many of them that lead to drowsiness, tiredness, dry mouth. I mean, it helps your dental practice also. So while reviewing the health history, you notice certain things on this guy, and you say to him, "Listen, I see you're taking a medication for GERD. Did anyone ever talk to you about the fact that maybe this GERD is coming from something called sleep apnea?" "No, I never knew that, doc." Say, "Yeah, it's something you might want to look into." If they have high blood pressure, why do they have high blood pressure? Has anybody looked into this? As we all know, high blood pressure is closely associated with obstructive sleep apnea. Maybe no one has ever asked. And it's amazing. I've been to so many physicians' offices in the last 25 years. You look at their intake forms, very few of them ask about snoring and obstructive sleep apnea or their sleep. Sleep is kind of, doesn't get enough attention. And so you may be the first person who's ever said, You know, the patient says, maybe you got something here. And then you have all these forms like the stop bang, which is remarkable, and it's been mentioned before. I think Rick Bonato mentioned it too. It's a great screening tool. So just look at this, like, and you think amongst yourselves, you know, maybe you have some sleep apnea. Do you snore? Are you tired? Has anyone observed you doing this? Is your blood pressure elevated? What's your BMI? Your age. Age is a big one. Age and weight are two of the biggest factors in here in this game, along with being a male. You know, the heavy necks, neck circumference, and gender.
So you have your patient who is in for their hygiene appointment, and you notice that there is no positive responses on the health history, but then you look at their stop bang, and you see that she marked down that she's snoring. So you always want to ask permission. I never talk to a patient and say, oh, you're snoring. Do you know that's related to sleep apnea? I would never go ahead right away immediately and offer help. I would always ask permission. So the first thing I say to my patients is, I noticed that you answered this on your health history. Do you mind if we talk about that a little bit more? And you could even say, you know, I took a course this weekend and I learned a lot about snoring and how it's related to a lot of breathing disorders. Maybe we can discuss that a little bit more. So in this case, very often you'll have kids in the room when hygienists are doing cleanings and their mom or the dad is there and the kids are sitting on the side. So in this particular instance, the little boy yells, yeah, Mommy, you snore louder than Daddy. And then immediately I heard Daddy snores. So I'm not going to interrogate my patient on her snoring, but then I'm going to say, well, your husband is snoring. How is that affecting you? Is that affecting the way that you sleep? Are you a little more tired during the day? Does he wake you up? Does it affect your daytime, you know, ability or cognitive function? Are you lack of focus? Just different leading questions, but I'm focusing on the husband snoring now. But the wife also knows that we're talking about the husband, but she's probably experiencing some of the same things as well. So find that motivation. So in this case, the wife was not motivated to take care of her snoring. It was more of a concern that her husband was snoring and disturbing her sleep. So after talking a little bit more, we find out they're sleeping in separate bedrooms. You're going to find out a lot of the population, married population or partner population, sleep in separate bedrooms because it's quieter, it's easier to sleep, you don't have a bed partner snoring. So what I was trying to key in on here is, do you want to sleep in separate bedrooms? It might be a little personal, but maybe you want to get back together with your husband and it could be a little quieter if there was an oral device in his mouth and yours too. So we talked a little bit about the pathology of snoring, and then we offered guidance. You know, what would be your next step? Are you going to refer them to a physician? You're going to kind of encourage them to go research on their own a little bit?
And don't forget, it's a lot easier cuddling up to someone with a oral appliance than with a CPAP mask. You know? So, okay, Epworth Sleepiness Scale. Really important, especially because the insurance companies value this very significantly. All right? This is a form that is an indicator of drowsiness. But what's interesting about this form is the more you do it, the more you learn. It's a sneaky little devil. It's a sneaky little devil. It's amazing how many times I've asked patients with their spouse in the room to answer this, and I get all zeros. All right, all zeros. The guy's got an AHI of 60. He's got all zeros. And I'm like, what's going on here? And they're like, you know, they just go through it quickly. You got to re-ask them the questions. The other thing is, the questions are a little antiquated. For instance, you know, which is the one that I love? Watching TV, for instance. Guy says, I never fall asleep watching TV. And then you delve in a little more. He hardly watches TV. The only game he ever watches is the Giants, the football, the NFL. And he's throwing things and he's jumping up and down. He's also having a heart attack, almost having a heart attack from the game. Of course he's never going to fall asleep. I said, what about if it's something your wife is watching that you're not that interested in, you know, Housewives of Orange County or something, I don't know, whatever it might be. And he's like, oh, that, I'm out like a light. So I'm like, Okay, so you didn't answer the question well. Things like, you know, do you, and there's another one that's tough is, are you drowsy when you're driving? Never. Or, oh no, what is it? Drowsy when you're driving? Yeah, never. And I found out he never drives. So he goes into the city with the train. You know, and you kind of have to tailor the questions a little bit more. You know, you say to him, do you ever fall asleep when you're a passenger in a car? And he says, I'm never a passenger in a car. I said, well, are you a passenger in the train? Oh yeah, I'm out like a light there too. So you got to tailor them and kind of understand these are very broad guidelines, and you got to tweak it for the patient a little bit.
Yeah. And where we live, there's a lot of commuters that commute into Manhattan on the Long Island Railroad, which is about an hour-long trip. And we'll ask them questions, do you ever nap? And they say never. And then we start talking about their career and what they do, and they say, oh, I'm not tired when I get home because I sleep 40 minutes on the train ride home every day. Right. So they're saying no to napping, but really they're napping every single 5 days a week.
It is amazing the answers. You had a gentleman who every night, not every night, but a lot of nights, he'd fall asleep and miss his stop. I mean, you know, that's another incredible thing.
So that's your patient.
Okay, so doesn't have to be scaling. I'm sure we've all seen this. The patient's in a reclined position. You're doing some dental treatments. All of a sudden, you know, you're hearing snoring, and you're like, this guy is apparently he's pretty tired. So you say, you know, are you sleepy? And he says, no, I'm not sleepy. And then you start looking around, and you see all these signs of things that are really indicative that he probably is very sleepy and has sleep apnea. His uvula, for instance, it's red, it's inflamed, he's got scalloped tongue, he's got an enlarged tongue, he's got a vaulted palate, he's got cross bites. And just like Gina was saying, we always kind of ease in the conversation and find a motivation to ask him, you know, how are you sleeping? Are you a light sleeper? And we try to just get the conversation going where we say, you know, I noticed some things on your medical history. I see that you dozed off here in the chair. Now, when you come to think of it, I am tired. And then you can move him along. And what would it be worth it? Would it be worth it for you to get a good night's sleep? And he's like, oh, you know, when you think about it, I really could use a good night's sleep. And then you move them along into getting this tested, all right?
So
go ahead.
What if you have a patient like this who has occlusal wear? Now, immediately in a dentist's mind or a hygienist's mind, you're thinking, oh, night guard, definitely night guard. Or talk about ortho or something like that, or maybe they are under stress and that's why they're doing it. But do you know that night bruxism is one of the most commonly reported symptoms that goes along with sleep apnea? So you definitely want to talk to this patient a little bit more about their bruxism or their occlusal wear.
And I just wanted to add something to that. Gilles Levine, he's the chairman up at the dental school up in Montreal, had a study it was recent, I can't remember the date, a maxillary occlusal night guard will increase apnea 50%, I think, with the studies. They actually works opposite for what you're trying to create here. So you see somebody with bruxing, you make a nighttime bruxing guard, you're actually creating more sleep apnea for them. So gotta be careful with that. And you know, someone saying something? I thought someone said I got a question. So so that's a tricky one, and you're going to have a lot of patients coming into your office who already have night guards made by other dentists, and you might want to look into that a little more and say, you know what, I think there's something bigger going on here. All right?
And definitely ask that permission again. Don't immediately say, oh, you know, your occlusal's worn down and you probably grind your teeth at night. I'm making you an occlusal guard or you're going to destroy your teeth. Talk to them. Say, you know, I'm a little concerned. The examination shows that your muscles were sore a little bit. Your teeth are wearing down. Can we talk a little bit about if you're aware of this and why is it occurring? And then the patient may say, well, you know what? I don't really sleep well, I'm stressed a lot, I have a really high profile job or a lot of children or, you know, really busy life and I'm constantly stressed and that's why I clench and grind my teeth. Well, maybe you're stressed because you have sleep apnea and you're being flooded with constant stress hormones that are affecting your body. I mean, there's so many other reasons why you could be grinding your teeth. So definitely talk to your patient a little bit further about this and talk about sleep apnea and the relationship to it, and correlate those symptoms with the sleep breathing disorder and see if your patient is, they feel comfortable with you, and maybe they want to look further into testing and find out, because instead of just treating the grinding and treating the occlusal wear, maybe you can treat a health disorder and save the patient's life, and then the result of that health disorder being treated is they're not going to be grinding and wearing their teeth down any longer. So we offer services, maybe an overnight pulse oximeter, or referring out to a physician, or depending on how you're going to work that in your model.
Okay, so we
talk
have this
about
patient, Sam, okay, just a lot of signs that would correlate with obstructive sleep apnea. Class 2 occlusion, you already have a protruded mandible perhaps. Periodontal disease, you know, there are a lot of correlations with periodontal disease and mouth breathing and drying the oral cavity out. The Mallampati classifications, for those of you not familiar with it, has to do with the height of the tongue in a certain position. You have them stick out their tongue, and you look to see, you know, can you see a uvula? Can you see an airway? So this will also help determine their likeliness to having obstructive sleep apnea. The large tongue, the occlusal wear we already went over. And so part of your hygiene screening, you know, the periodontal diagnosis may have some correlation there, and we can start looking in that direction. And you talk about, we're seeing these pockets, you want to create this rationale explaining the relationship between that. All of these things are just introductions to opening the discussion of obstructive sleep apnea. And again, we're going to offer all this testing and hopefully improve not only the apnea, but the periodontal disease. So they're all linked together.
One of the things that I find when you're working with the team, when your patients are coming to, or they're sitting in the room for a few minutes with the assistants waiting for the dentist, or they're seeing the hygienist for the hygiene visit, we have really great relationships with these patients. Sometimes the dentist will say, you need a crown, and I'll say, what do you think? Do you think I should get the crown or not? So they really trust us, and they value what we have to say as well. You know, in their mind, they're thinking, well, it's the dentist, it's their business, they need to pay their bills, but the people that work for them, they don't have to worry about making the money, so they're going to tell us the truth. And we know that's not the case, but in the mind of a patient, sometimes it is. So they you want to have that comfort level. And especially with hygienists, you're seeing that patient every 6 months or every 3 months. You really have that close rapport with the patient where you can say, you know what? I'm a little concerned. You have immaculate home care, but we can't get control of your periodontal pockets. And Dr. Seltzer and Dr. Ryan, they treat patients for sleep apnea, and some of those patients have had periodontal disease, and you know, maybe you should talk to them a little bit about what else is going on in your life, and maybe we can push this conversation a little bit further.
So your auxiliaries are really essential in helping that, and our assistants also, you know, the assistants, they're in there and we leave them alone with the patients for a while, and same kind of conversations. And you know, talking about who the patients believe, and we'll talk a little bit more about this when we get into the, talking about how we've branded ourselves and we did this NFL thing, but it brought up a funny story, so I wanted to share it with you. I had a patient came in one night, and he was referred by a multitude of physicians along the chain of how it came in. Every one of these were trained Harvard, MIT, you know, Berkeley. Then he comes to us, we're well trained also. He's still on the fence. Should I treat my apnea? Should I treat my apnea? He looks up and he sees we have some of the football players have signed endorsements of people we've helped. He says, you treated that guy? And I was like, yeah. And I said, he's doing well. He says, okay, I'm in. So it's just incredible how people will believe certain people, and you know, like she was saying, they trust the hygienist over the, or the assistant over the dentist sometimes because of the motivation. I'm amazed sometimes how that happens, and so it's just interesting. So, yeah. It's a whole full court press that you need to sometimes convince someone to do something.
So creating value, what you really want to make sure in your practice is that you've created a culture of health and wellness. So you have, posters in your reception area. Everybody is educated and knowledgeable about dental sleep medicine and obstructive sleep apnea, and they talk about being healthy and promoting that culture in your office. You want to make sure that you've identified all the risk factors for sleep breathing disorders, and you've talked to your patient about that. You've educated them, you've made them aware of the importance of sleep and its relationship to comorbidities and their health as well. And you want to provide rationale for sleep testing and referral. Don't just say, I think you have it, you should go get tested, but find motivation and what's the reason, and make sure that they believe that they need that treatment or need to look further. And make it easily available for them. Make it accessible to have sleep hygiene tips and easy apps on their phones and testing, and have referrals ready and relationships with those doctors as well, so they don't have to go out searching and I have to make another appointment with another doctor and do this and do that. Make it easy for them. Have that available.
So this slide about philosophy, what's your philosophy? So there are a lot of people here from around the country, maybe different ideas of how you're going to market your sleep practice, relationships that you have with your physicians. Some of this might even be related to state laws that exist, who you can do business with and at what level. Are you going to be a practice that gets your patients really from physicians only? Are you going to put advertisements in local papers and magazines? Are you going to go to the public? In our practice, we kind of do both, but it's evolved. We started more at the beginning with the public, and we've evolved now into really probably 98% are just coming from the nice relationships we've built with the medical community. It's the nicest way to go because they're set up on a tee, ready for you to hit the ball out of the field. They've gone through all of the medical hierarchy, they've gone through sleep testing, and maybe they've already struggled with CPAP, and so they're ripe for the picking. Mm-hmm. And it's a nice way to go, but it takes a lot of work to do that.
Just to quickly jump in on that, your patients that are coming from physician referrals, they already have that knowledge and education. They are one of your best patients, like you were saying, because they've already gone through hearing about sleep apnea, hearing what it does to your body, or maybe failed a therapy before, and they come looking for help for you as well. So those are one of your best patients.
And when you go to the public, it's a good way to go, but it's harder work. I mean, you're going to be a screening machine on the phone. Your front desk reception has to know how to get that patient organized. They're going to have to say, okay, listen, you've never been tested, we've got to send you somewhere, or you can come here. Depends on how you operate. We don't do a lot of preliminary testing in our office. We network and send out to physicians. Where do you live? What town? I have a great pulmonary person or a sleep center right near you. And that helps build our relationships also. So it depends how you want to do all that diagnostic testing.
So we thought we'd take a couple minutes here to take a breather a little bit. This is
something you don't see in Arizona.
Yeah.
That's the South Shore of Long Island, looking out at the Atlantic Ocean. It's a nice place to live.
These are Dr. Seltzer's footprints here, walking back and forth, trying to figure out what to do next.
Exactly. So do we have any? We have a lot more to go, and we have about another half hour. I hope everyone's still intrigued and interested. But any questions at this point, or anything that we? Okay.
Question.
Mm-hmm.
Gina's program through the other group that's in Arizona. Do you have to be a member of that group to participate in that
No, you don't.
online version?
No.
You just go to their website?
You can go, I can give you information later, but if you go to their website under credentialing, they do offer credentialing for RDH and auxiliary, and with that credentialing comes a 1-year membership into the ACSDD.
Okay.
All right.
I'm going to keep moving.
So back.
Okay, so at this point, we've gotten our potential sleep patient. We've got them interested in looking into it. We've made this referral to find out, do they have sleep apnea? So they go back, and now the ball is, they're calling us. They said, hey, you know what, doc? They said that I have sleep apnea. And they're recommending, I don't even need CPAP. They said I'm mild, I'm going right to you, I want an oral appliance, the thing you showed me. So again, this is kind of how you have to gear up your team to know how to get that patient as they're coming back to you.
in.
All right, so you have reception first of all. Do they have all of the protocol in place so that you can treat them effectively, and can you get them coverage for that? And that all has to do with these forms here. Physician referral notice. We're going to need, you can't do this, at least I don't think you can do it in any state without a medical RX. So in New York, we can't touch anyone without the RX. It's like going to a pharmacy. Can't get meds without with the RX. I tell patients that. We can't even go in your mouth, we're not going anywhere near you without the doctor making the decision.
I'm going to just butt in for a second.
go ahead.
And what you can do, and what we have in our practice, which I find works great, is make a checklist for your front desk, and whatever information that they need to get from the patient, that they will check off as they get it. So it's a little bit easier. They don't have to try to remember it each time. So did we get the physician referral check? Did we get the RX? Do we need a letter of medical necessity? Do we have their insurance cards? Did they sign their affidavit? Things like that will help.
And you know, again, we're constantly working as a team. We have weekly meetings. How do you handle some of this frustration? Now, you got to have people at the front who they can calm people, they can put out fires. There are patients that get exasperated from saying, I called the doctor's office 10 times already. And he's, well, we still don't have that information, we'll try and get it for you, blah, 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 you know, on and on. So you need people up there that can get this information. We need the sleep study, we need the RX, we need the referral. In some cases, we need an affidavit saying that they can't tolerate CPAP, or they tried and they're struggling. Maybe they're claustrophobic. Letter of medical necessity. And do they have insurance, and are we getting all that information up front? We want to be prepared. We're trying to make this thing, you know, foolproof, easy. Come slide through the process easy. And then once they're in and the clinical team has them again, we're going to go through, just like the physicians, we're going through what's called the SOAP notes: subjective, objective, assessment, and plan. In your subjective findings, you need to put down all of the subjective information, what the patient's symptoms were.
Chief complaints.
Yeah, chief complaints. Objective findings: their neck was this size, their AHI was that size, it was this amount. And then you're going to make an assessment. I think this patient is or is not a good candidate for oral appliance therapy. You know, it can also happen that the patient, and it happens a lot, is not one of our dental patients. Maybe they need dentistry, and we're going to assess them and say, you're a good candidate for oral appliance therapy, but you need to fix this bridge or do that dentistry first and send them out there. That's part of the plan, all right? That's part of the plan. And our plan is, how are we going to treat this person? What's the order of importance? You got to get some of the dental work out of the way. And which appliance is best for this patient? Are they a dentulous? Are they a dentulous in only one arch? Do they need a bridge here? Are they planning on doing dentistry? Oh yeah, and you know what, by the way, in about 4 months, I'm having all my teeth veneered. You know, wow, okay.
Or
so
Invisalign, yeah.
You know, you better know that. And then, you know, you also have to have that discussion and figure out, maybe you want an appliance that's easier on veneers and porcelain than another one. Do you need one that maybe can work better with implants? So all that information is part of that plan, and the clinical team needs to do that.
And one of the things with SOAP notes is you probably do this a little in dentistry, but you don't have it in that format. And with medical insurance, you need to submit specific documentation for all your patients. So following SOAP notes is going to help you a lot. And when you're doing your objective, you want to make sure you put in information about your dental exam, as well as blood pressure, height, weight, and all constitutionals too.
And then, of course, having this your management end of the team. The financial and medical part, we talked a little about that, and that's a really, you know, it's a really tough part to deal with at the beginning, but once you have that system in play, it's pretty smooth. Other things that are going to help build your practice: recare, long-term, and follow-up. Kent alluded to that also. Dealing with the medical world, you want to keep that relationship going. You want to know, you want to make those physicians know that their patients are under your care for the long term. And it does a lot of good for your your own practice, because you're going to find situations that are occurring. Perhaps there's, again, a bite change, or there's something you have to discuss with their dentist, and they're not even bringing it up. So we follow a protocol where at the beginning we're seeing them quite a bit, then we're seeing every 6 months, and then we go on to a year. The correspondence, we'll talk about that a little more. It seems like everybody who comes to talk about oral appliances shows you a myriad of them, and there are out there. It's more of an art than a science. It's the kind of thing that you're going to, I certainly suggest you get involved with as many as you can. The more tools you have in your armamentarium, the better off you are. And you're going to find what you like works best for you in certain situations. Which, we can build these on dentures, we can build them on partially edentulous patients, people with gag reflexes. I'm just trying to think of some of the things as I'm seeing these pictures. People with TMJ, narrow arches, which one works best for this, which one works best for that. You're going to have to learn that yourself along the way, but open your mind.
Home care, some of them are easier to keep clean than others, and your patients that have horrible home care.
Some of them
Be
are a
careful.
little more easily adjustable also.
Easily adjustable, patient dexterity. You may have seniors that have healthcare, assistants that are helping them placing devices in and out of their mouth or using their CPAP and all. So you really have to match the specific device with the patient.
They're all good.
Yeah,
and they
I
all
could
work.
say from even my own experience with my husband, he's been fortunate enough to try probably 8 or 9 different devices, and so we know what works better for him, what feels best in his mouth. So it's not really that the device, this is the one and it's going to do it for you. It's what works best for you as an individual, what's going to fit in your mouth, feel comfortable, work with your dentition, and get the best outcome for you. And we've been known in the past, if one specific device is not working for a patient and we truly feel changing the device will help to improve the outcome, we'll change it for them. It's more important for us to have a more healthful outcome for the patient than it is to make the extra few $100 on the device.
And I can't say enough about that. You start to build a reputation of the person who's going to get the job done. And even sometimes when you don't get the job done, if that patient said something to the physician or another patient, this office will work and work and work with you. And there are plenty of them we've lost money on, but you know what? When you look at the big picture and you're building something for the long run, it's worth it. And if you can finally get them help at the end, it's also worth it. All right?
Yeah, and one of the things a lot of patients will ask you, and they ask this with everything, is there a guarantee it's going to work? If I have to pay for it or try it or whatever, is there a guarantee? I always tell them the only guarantee that I can give you is that we all here will work as hard as we can to get the best health outcome for you and make sure that you're happy.
I don't know where I wanted to say this, but this is probably a good point to say it. A really big thing that you have to have a conversation with your patients, maybe it's while you're selecting the appliance, is the difference between snoring and apnea and what you think is going to happen as far as expectations with that. I personally find apnea easier to conquer and take care of than snoring. Snoring is very subjective. Apnea, it's a number. You either did it or you didn't do it. You got those numbers down, and you have the studies to prove that to someone. Did you get rid of my apnea? Yeah, you went from 60 to 4 AHI. Incredible, right? What if you took that 60, that patient who went from 60 to 4, and they're still snoring, and their wife is really pissed off? It's like, now what? How do you have that conversation? Well, you better have it at the beginning. You better tell them they're 2 different entities, they're connected, but we don't know how snoring is going to do, and we also don't know, how sensitive you, Miss or Mr. So-and-so, how you are sensitive to that snoring. And there are some people, you can reduce their snoring if you measured it in decibels to a pretty quiet number, but for the bed partner, it's still not good enough. And that's a tough hurdle. And there are things we can talk about at some point if we have the time, how to conquer that. But that could be a tough one, and you should have that conversation at the beginning. So impressions and bite registrations, these impressions need to be as good as your crown and bridge impressions. That's the best I could say. They need to be accurate.
Yep.
All right?
I've spent years and years trying to get the best impressions. And especially assistants and hygienists probably don't take impressions too often, especially not these accurate VPS impressions. A lot of the times you're just doing quick alginates. So it takes a little time, a little artistry to kind of figure it out, and little tricks and trades, but your labs will make a much better product if you provide a really accurate, precise impression.
and
So
the
take the time to really do that.
Yeah, and the long-term side effects and things like that, all better the more accurate your impressions are. You're seeing different bite registration techniques, you know, like a George gauge. A lot of the companies now have developed their own variation of a George gauge, which measures anterior, posterior, and also adds some vertical to it. These are things that you can have conversations all day about, and we're not going to delve deep into that. I also showed the Airway Metrics product, which is a pretty cool and unique way of finding out maybe where a good position is, and there's now a lot of people using this phonetic bite, which is also a pretty cool, good way to go. And you got to dabble and play and see what works best for you.
All right, so we're going to talk a little bit about device delivery. So in our practice, I do some of the device deliveries as well. So you want to make sure that your hygienist is trained in using hand pieces and working with oral devices and knowing specifically how to do the adjustments and changing different shapes and sizes for comfort as well. Okay. So during the device delivery, we take photos of the patient, just so we have diagnostic photos. We also take photos of the device. We always check for undercuts, make sure that there's no excessive pressure. Midlines are key. You want to make sure when you take your bite registrations that your midlines are accurate, and mark that on your lab script. So if there's any kind of deviation on your midline, make sure that the lab is aware of that, or they'll think that you did the bite registration incorrectly. Make sure the occlusion is balanced. There's TMJ, craniofacial comfort, ability to use the device, insert it in the mouth, remove it, and what the expectations are, and make sure you sign a consent for delivery. That's important.
Okay,
you want to
morning
talk about
repositioners, really important. Another discussion you have to have, and Kent, he did a beautiful job earlier about, if he's in the room, thanks for helping me out with all that stuff. That was great with you know, giving those statistics and things. So there's going to be bite movement, and you've got to have that, and jaw changes and all kinds of issues. But you have to have that discussion with the patient, and as you're moving along, you have to have that discussion about, at all points, are we going to keep going where we're going, or are we going to discontinue treatment and perhaps send you back to a CPAP or some other alternative treatment? Got to have that discussion. I'm not going to spend a lot of time because we still have a lot to go. We only got about another 15 minutes. Follow-up titration. We're going to get this patient via subjective information. We're going to titrate them. We're going to adjust all kinds of things to get them into a position that we feel is clinically the sweet spot that we're looking for. And how do we kind of get that? We're looking at symptoms that they're talking about. You know, I'm sleeping better, I'm dreaming more, I'm less tired, my wife says I'm quiet, et cetera, et cetera, et cetera. And then
one of the things we do is give them a sleep diary so that they can keep track, and I also involve the bed partner or whoever's in the operatory. Sometimes they'll bring family members in that sleep diary, what you're experiencing when you're sleeping. If they keep track on a daily basis, it's wonderful, because when they come back in, you can have that conversation with them, and they won't come back and say, oh, I think I snored on Wednesday, and maybe I woke up twice on Thursday. So having this sleep diary is really a good positive thing.
Okay, so again, we're going to gather and see how efficacious we were as far as adjusting what's going on, all the side effects. I want to move along a little, Gina, because we're going to fall behind. All right, and so we're about to send this patient out back now to see how do we do, right? I mean, we've done all this tweaking and we've done all this titrating, and so that other slide's real important, the one that Gina had about never let your patient leave without a follow-up appointment. Two big reasons. The medical world has given you the privilege to treat this patient, and it's a big responsibility. You can't just let it go. You have to make sure you're following up, because while they're under your care, there's an assumption that you are caring for them. And so you've got to medically, legally make sure that you're documenting, I've made the next patient, I want the patient to do this. If they don't follow through, the onus is on them. But, so from a medical legal standpoint, really important to never have them leave without another visit, because you can now say, hey, I told the patient to come back, they never followed up, and you have to communicate this with your medical team, with the referring physician. They gave up, they didn't come back, we never saw them. And so we've sent them out, and we want to know, did we hit a home run or did we strike out? A little bit of trivia right there. I don't know if anybody, well, there are some people that are on the, closer to my age. That's a world famous New York Yankee from the 1960s. I'm going to give you a couple of hints. I don't know if anyone will, if you can read his name there, but he was a first baseman in the 60s, number 25, Joe Pepitone, Uncle Joe, Gina's uncle, Joe Pepitone. Gina is New York Yankee blue blood. And so that's who that was. So we send the patient out, and they come back. Now let's just say that you hit that home run, you reduce their AHI to a great number, and you've had this conversation with them. You tell them, look, if your numbers are great, we'll see you, in 6 months, and we'll follow up, and call me if you need anything in between. Alternative options. They send you back, not that it's a disaster, but maybe it was, or maybe you didn't do as well as you wanted to. Getting involved with all these other alternative treatments. Positional therapy, maybe using something like a slumber bump. Hybrid therapy, using combinations of things, but if you don't know hybrid therapy, it's something like a top-pop, okay, where you're combining oral appliance and CPAP together. Biofunctional therapy, training the tongue position, swallowing, building the neuromuscular function. And there are people out there teaching the didgeridoo, right? The Australian instrument, builds circular breathing, building the pharyngeal muscles. These things all work, and they're all theoretically out there for you. Dietary, sleep hygiene.
This information is also great for your staff, your auxiliary, and your hygienist to know and learn about. Talking about, you don't have the time to sit there and talk about sleep hygiene. You don't have the time to talk about dietary counseling or other issues that are going on. So you can actually give this up to your auxiliary to help out a little bit with your patients. We have lots of little papers, tips and tricks. I did great. I don't have sleep apnea anymore. The oral device is working for me. My AHI is a 1. I'm not snoring anymore, but I sleep horrible. Talk a little more. TV's on all night. I sleep with the TV on. Talk to them about the way it affects your sleep, blue light, and different things like that. So make sure your staff knows how to talk about that.
Really important part that I found in our practice, building our sleep practice, was it disappointed me how I found that so many of the medical people that had touched this patient's life were not connecting to each other. And Gina and Jeff and myself and the staff, we've become kind of this binding tool. This is the old kind of fable or whatever about the blind man and the elephant, where each one of them is touching the elephant, not knowing that there's other parts. So one person says, oh, the elephant is a spear. Grabs his ear and says he's a fan, or this one, he's like a rope, but none of them see the elephant. Sometimes the same thing with the sleep patient. Sometimes we're the only one that spent the time with the patient and linked all those medical people together. So it gives you an opportunity to really become a leader in your area in sleep and kind of coordinate all those other medical facilities. And we do a lot of communicating with all of the patients' physicians, from other dentists to their primary care to all the specialists. It does a lot. It ties it all together. Everyone knows what's going on. We're a leader in that area. And the other thing is, it's a marketing tool. Everyone knows who we are. They're all seeing each other. They know who's been corresponded with. And we get testimonials from patients. We ask patients to write letters to even tell their physicians how well they're doing. So
one of the things that I love to do is when a patient comes in and they start saying, Dr. Seltzer did such a great thing, and I'm sleeping in the bedroom, or you made a great device, and I'm so happy, and you're the first person that ever explained what sleep apnea is and how it's affecting me and made me want to treat it and work really hard on this. I say, you know what? Thank you so much for that compliment. And what I would really love to ask is if you can write a letter to your physician just saying thank you for sending us here and allowing us to work with you. And I'll hand them a letter, and they'll just write it up to their physician, and we'll mail it out for them
So we're
too.
constantly trying to do the best for the patient, and at the same time, trying to market ourselves to be the best for the physicians also. Quick little say on this. It's a sad commentary about what's going on the planet. We have a situation where many countries in England value oral appliance therapy, continuous oral appliance open airway therapy, and value it equal or even above CPAP. Here in the United States, we're really fighting against the tide, and it's going to take a lot of effort from the dental community to show that oral appliances really are something special and can deliver.
And these are only the people that are treated. What about all the population that is yet to be diagnosed?
Okay, so in terms of making yourself special, outstanding, your team, it takes a team. Jeff and I could not have done this without that team. We've branded ourselves, we've communicated, we've been very good at coordinating the team, we've marketed ourselves, and it really all comes together at the end, and it's a rewarding field. Like I said, it's lifted dentistry. I'm proud of that. It's lifted dentistry from just a couple of guys who are filling cavities in teeth to medical specialists who are saving people's lives. And when we first started this, back with Richard and him coming and being desperate and me making a boil and bite appliance for him and me not snoring, I never knew that saving lives and having this rewarding career was out there. But it is out there for all of you to grab. It takes work, but it's worth it. I love going to work every day. This team is fantastic. It takes time to build it. You gotta put yourself into it and select and do that. But having someone like Gina with us has been remarkable, and we're moving constantly in the forward direction, and I can't wait for tomorrow and do it again. So thank you very much.
I just wanted to add one other thing that I can tell you from the staff point of view, that having a dentist or a boss that is trying to make sure that you are part of the team and offering you that education and that knowledge and helping you to be part of that practice and grow it together makes you feel like you want to work harder and work for them and build their practice as well. So
Thanks.
I wanted to say thank you, and I
Thanks
hope
for
you're all
saying that.
like that.
So if you have questions, I'll be here for a while.